Okay, Fred, we usually don't do topical things in the news, but this death of Matthew Perry hit me really hard. I
Yes.
was in college when that show kind of became a big deal, and it was that was probably the last big show that everybody was watching.
Yeah.
So, what I have a question for you. I know you don't know anything. You're not the coroner. You don't know specifically, but I think you can give us some insight. How does a 54-year-old man drown by himself
In his jacuzzi,
in his
no
jacuzzi?
less. So
Yeah,
it's not a large body of water.
exactly.
So it's not like we're talking about someone sailing and they're intoxicated and fall and they're navigating turbulent waters, right? It's in a jacuzzi,
Right.
right?
And the to be clear for all the conspiracy theorists out there,
Yeah.
the coroner has already ruled out any foul play. So he drowned in his jacuzzi, and how does that happen to a 54-year-old man?
Yes, it's obviously a rare situation. So the things, and again, I have no insight into Matthew Perry's life or his personal behaviors. So I'm just going to go through the things that a cardiologist would think of first.
Right.
So the one and obvious one is that he had a cardiac event, specifically a cardiac arrest related to an acute coronary syndrome. So in basic terms, he had a heart attack and then he had a fatal arrhythmia, and these are called ventricular tachycardia that can then degenerate into ventricular fibrillation. So the heart was not pumping effectively, and if
Right.
he lost consciousness after a few seconds, which is what typically occurs, then he submerged, and unfortunately, he drowned because of that. So that would be at the top of the list, and
Okay.
certainly the coroner can determine that if he did have an acute coronary syndrome, because he can tell whether the heart muscle sustained an injury. In
Okay.
other words, a shortage of oxygen, right?
They're deferring the autopsy.
The family is?
No, the coroner.
The coroner.
He hasn't ruled yet. He's deferred it. I think they have to do more toxicology tests or something.
I see. So that goes to the next cause, of course. And I do not know any history about Matthew Perry. I know we loved his character on TV, and he was wonderful, and in other productions he was in over the years. So if he had a history, past or present, obviously is very important, of substance abuse.
Which he did.
Yeah. And so many substances can cause impairment of cognition. They are psychoactive medications, whether they are by pharmaceutical medications prescribed by a competent provider, physician, mental health therapist,
Right.
or recreational drugs that can cause impairment of cognition and awareness, and increase the likelihood of somnolence and or
Somnolence means
falling asleep.
okay.
Yeah. In other words, are depressing the central nervous system to such a degree that you are not aware of your surroundings, and you are basically not aware of anything around you. So if he had used a variety of different psychoactive medications that depress the central nervous system, he could have passed out and then submerged and again swallowed water, asphyxiated, and from there you have a cardiac arrest, and that would have been the cause of death. And that can be, again, determined at autopsy. It's pretty straightforward. If the asphyxiation and drowning came first, and then the cardiac arrest next.
So he would, when you start to drown, your body reacts to that. So
Yes.
So he must have had something like that where for his body not to wake itself up.
Yeah. So if there was some suppression of the central nervous system, of the vigilant mechanisms that we have in our amygdala, which is our security system.
The lizard brain.
Yeah, to say, hey, wake up. There's something going on here. I'm not getting enough oxygen. Let's go. get out of whatever situation you're in and take a breath, right? So those were suppressed. If, again, we point towards psychoactive meds suppressing his respiratory drive, central nervous system activity. So, and then, of course, there's another possibility associated with that, which is going into withdrawal because of substance abuse. So opioids, for example, alcohol as well. These are drugs to which we become dependent on. And when we don't have them, then we go into withdrawal.
Right.
And so dependency to one of these type of substances can result in withdrawal in a seizure. And so that could have occurred as well. And he did not have, obviously, or people who have this issue, withdrawal seizures, do not have motor controls, so they can slide into a body of water like a jacuzzi and become submerged, again, swallow water, asphyxiate, and then, of course, they have inevitable cardiac arrest.
So what you're saying is it could have been because he was doing drugs, or it could have been because he stopped doing drugs
Abruptly.
and his body was craving it, and so that's where the seizure comes from.
That's right, a withdrawal seizure. So, that's another cause of it. And then there are rare causes. I doubt he had a congenital heart disease. And there are some that cause an immediate cardiac arrest. And, you and I have been involved in sports, in the sports world. So there are certain people that have something called hypertrophic cardiomyopathy. That would be the number one cause.
Like Hank Gathers.
Correct. Yes. Like him and some other basketball players. And
Reggie Lewis.
correct. That had hypertrophic cardiomyopathy. And unfortunately,
How
sustained
rare?
a cardiac
How
arrest.
rare is that? Sorry to interrupt. How you're a cardiologist, so
Yes.
I remember when we went and you checked out all those kids at that volunteering
school.
your time, which
Yes.
by the way was awesome by you, because those kids couldn't afford it. That's what you were looking for, right?
Yes. Well, among other things, I was looking for murmurs, valvular dysfunction, arrhythmias, hearts that were enlarged, and so abnormal heart sounds, abnormal murmurs, because there are normal murmurs that are called flow murmurs. Anyways, I don't want to get too much into the weeds.
Sorry. Yeah.
But so these conditions, there are over 100 different genetic variations within hypertrophic cardiomyopathy, and every year more are discovered. But there are only some that are called the malignant ones, the ones that actually result in cardiac arrest at an early age. And those can be identified sometimes clinically, but now they're best identified with genetic testing. And most of the time, those young individuals have a family history of it. So I doubt that Matthew Perry had, in his immediate blood relatives, a condition that resulted in sudden cardiac death because they have hypertrophic cardiomyopathy. That's where the heart muscle gets thick, and it sets up a perfect storm of abnormal heart rhythms that result in ventricular fibrillation and death, especially with exertion, which is why it occurs during playing or immediately after in, say, the basketball players you mentioned. So the incidence of this, depending on the genetics, could be 1 in 50,000 or 1 in 500,000, somewhere of live births.
Okay.
That have some degree or will develop some degree of hypertrophic cardiomyopathy. Many of these people, as I said, will have minimal or no symptoms, and it becomes an incidental finding. So they can live a normal life or longevity like anyone else in their community. And so
What are the chances of someone his age it being that? Very low, right?
Yeah, very extremely low. I would say, less than 1 in a million.
Okay. So it's probably
by this
not
time.
that.
Yeah, of having a malignant type of hypertrophic cardiomyopathy. Usually it occurs in much younger teenagers, people in their 20s, and so on, when they suddenly have a syncopal event, meaning a passing out event. And then once the workup is completed, then it's determined that they have underlying cardiomyopathy. And there are different, as I said, variations of hypertrophic cardiomyopathy. So that's people like myself and others specializing in congenital heart disease employ a workup that reveals not only the type they have, but the genetics, and then the recommendations on what to do thereafter, including the implantation of a intracardiac defibrillator in case that they do have an event. Then the mechanism of that defibrillator detects it, and they're able to be shocked out of the cardiac arrest. So rare cases. So I doubt that happened to Matthew Perry. Another one,
especially since he was so old, so it probably would have come up
yes,
a long time ago.
he would have had it. There are other, I guess, entertainers and celebrities like John Ritter from Three's Company.
Oh, he was another great one.
Yeah, but he had a different issue. He had an ascending aortic aneurysm that ruptured. So I think that happened when he was in his early to mid 50s as well. So if you can imagine, if he had been in a jacuzzi and had one of these rare congenital aneurysms right there at the start of the aorta, where it joins the aortic valve and the actual left ventricle, and it ruptures, so you die instantly because the blood goes around the heart and causes cardiac tamponade, and so the heart can't beat. So if he had been in a jacuzzi, he would have drowned as well. So that's another type of congenital issue that comes from a weakening of the fibers that form the aortic root. It should be a nice elastic and a combination of collagen and elastin fibers that there's a genetic, unfortunately, mutation that causes them to weaken, and over the years they expand until they rupture, pretty much like those little bubbles on a tire that,
Okay.
the rupture. So that's another one. And then there are other syndromes, and I have patients with most of these. One is called long QT syndrome. So again, young people have a cardiac arrest because on their electrocardiogram, one of the segments is prolonged, and so an arrhythmia can occur.
And arrhythmia means it doesn't beat properly?
Correct. Either they go into something called ventricular tachycardia and then ventricular fibrillation, or in some cases, they have congenital heart block where the heart goes so slow they have a cardiac arrest because of the slow heart rate that isn't able to pump blood not only to the body but to the heart muscle itself. Remember, the heart pumps, and some of that blood goes into the coronary arteries that surround the heart muscle. And so if the heart's too slow and it doesn't pump sufficient blood, less goes into the coronaries, and so the cardiac muscle is starved of oxygen, and it goes into a malignant arrhythmia that causes the cardiac arrest.
Okay.
So, and there are different kinds of long QT syndrome, and they're treated a little bit different depending on the underlying genetic issue and the type of channel that is abnormal. Potassium channels, sodium channels, calcium channels, for example.
Now he's been, an actor. He was insured for a lot of money. Wouldn't a lot of these conditions that you're listing have come up in previous exams, or is this the kind of thing where you don't know about it until it happens?
No, you're absolutely correct. Those would have already been uncovered. Again, we're talking about very rare things. I think the first three are at the top of the list at the beginning of this conversation. I'm just going down through the list of various congenital heart disease issues that are incredibly rare, but less likely in Matthew Perry.
Got it.
And another one, that you and I know about is Pete Maravich.
Sure.
So Pete Maravich had an anomalous origin of one of his coronary arteries. Instead of the usual place where they come off, one of the main arteries that feeds the heart muscle, called the coronary artery, was coming off the wrong place, and it was getting squeezed between the aorta and the pulmonary artery with each heartbeat. So an anomalous origin of a coronary artery can cause sudden cardiac arrest as well. So it was fortunate that Pete Maravich played all those years without that happening, and it's my understanding he was playing some pickup ball after he retired.
That's right.
When the event occurred. And then this was a finding at autopsy later on.
No one knew.
Yeah. So I believe he had the left main coronary artery was coming off the right coronary cusp and traversing in between the pulmonary artery and the aorta. And so on getting squeezed repeatedly, it choked off blood flow to the left ventricle, which is where the majority of the heart muscle is, and it relies on that blood flow. And so he had a cardiac arrest. And then, there are other congenital heart disease syndromes that are even rarer, like right ventricular dysplasia, where the right side of the heart gets infiltrated with fatty tissue. And again, it sets up for what I call reentrant or arrhythmias. And so you go into the patients who have that go into a cardiac arrest. And again, this would have all been diagnosed in Matthew Perry way before, as you mentioned, because of those probably life policies and life insurance.
Well,
and
not
so on.
just life insurance policies, but the studios that have contracts for they were making $1 million in an episode by the end.
Yes.
That they're covering themselves and having physicals done to make sure that they're going to sign those documents. So
yes, absolutely. And then, we don't, because you at the beginning of this said there, no poisonings, there's no homicide, no foul play. I'm not going to get into other causes to have to drown in a jacuzzi that would be a homicide or foul play.
Well, because the conspiracy theorists are running wild.
Yeah.
They're talking about, this was all, that we don't.
Yeah. By far, to summarize on this, it's incredibly sad because most of us are at that age group. And so we imagine, it could happen to us. So the number one, clearly a heart attack, where he had a, atherosclerotic plaque inside one of his coronary arteries that ruptured. And when that occurs, a blood clot is formed and blood flow is interrupted to the heart muscle. And so the patient, the individual goes into a cardiac arrest and the arrhythmias that I mentioned. And if the brain does not get oxygen for a few seconds, you pass out. And so you can submerge and drown. And also, even if they would have gotten him out after 4 minutes, it's highly unlikely that he would have had brain function thereafter because time is muscle. And so the quicker you get to the heart.
Time is muscle?
Yeah. So heart muscle, when you sustain a heart attack and the blood clot is interrupting blood flow, unless you get an immediate angioplasty and a stent, heart muscle is lost, and you possibly have irreversible damage if you do not open up that vessel within a period of 6 hours. We still do the angioplasty and stent even up to 12 and 24 hours, and some people recover some function depending on multiple other factors. In other words, collateral vessels that feed the same territory of the infarcted area. But when you have a blood clot in the culprit artery where it ruptured and it stays for more than 6 hours, it's highly likely you're going to form a big scar there. And in the brain, it's 4 minutes. No oxygen for 4 minutes. It's highly unlikely you're going to recover 100% of your, cognitive prefrontal cortex function. So
when I was growing up, our neighbors, their kid had fallen into a pool, and so I'm familiar.
So that's
with
why
that.
I say time is muscle. The heart muscle is far more resilient than the brain. But I keep saying time is muscle. That's why for any of you out there, the symptoms of a heart attack, if you're, let's say you're middle age, you may have 1 or 2 or 3 risk factors like prediabetes, diabetes, hypertension, cholesterol abnormalities. You're a smoker. You have significant obesity, insulin resistance.
You're a man.
Sleep apnea. You're a man. You're, late 40s, early mid 50s, or up to early 60s. You start having chest tightness, chest pressure, especially with minor exertion, like carrying your groceries from your trunk to the kitchen,
Right?
Or going up one flight of stairs, or walking one block. Or all of a sudden you break out into a cold sweat with shortness of breath, chest tightness, chest pressure that starts slowly and increases gradually over the next, several minutes. And even if it subsides, you got to suspect you are having coronary insufficiency. That is, you have significant atherosclerotic disease in one or more of your coronary arteries. and you ought to be seen by somebody that knows what this is all about. So vitamins aren't going to help. Okay. Watching videos on YouTube, not necessarily going to help unless they're telling you what I'm telling you.
Levers, the podcast.
Yes, unless you're on top of what I'm saying. So you got to get help. Get to the ER. Call 911. Make sure a loved one, a friend, someone is with you to help you. And this is why I think all schools ought to have CPR teaching and advanced cardiac life support classes, especially in high school and universities and colleges. This is one of the reasons why most public venues and certainly athletic facilities have defibrillators or, available at the facilities so that they can be implemented quickly because time is muscle.
What about aneurysm or stroke?
In him, that's a great point you bring up that I should have already mentioned. It is very, very much in the differential diagnosis that he may have had congenital aneurysm in his brain, a Barry aneurysm that ruptured.
A Barry aneurysm?
Barry aneurysms, that's what they're called, in one of the major arteries in the brain, in the intracranial arteries. If they are dilated, an aneurysm is an abnormal dilatation of one of these arteries that balloons out and ruptures, like putting too much air into a bicycle tire until it ruptures. But they're focal. They're not throughout, just in one area of the cerebral, arteries. So that could have happened. Another one could have been a major stroke, of course, that would have left him, paralyzed on one side or the other, and could have impaired his level of consciousness to the point that he submerged and then didn't have the motor ability to get out because he was having a stroke that left, one side of his body without motor function. So yes, those definitely enter into the differential diagnosis. And of course, just a seizure, not affiliated with strokes.
Or withdrawal, just a regular old.
So I was going through the cardiac ones. We talked about the drugs, the drugs that make you lose consciousness, the drugs that upon withdrawal give you withdrawal seizures, then cardiac causes, and then neurologic causes would be the category that you're pointing to.
Right.
So you are correct. Barry aneurysms, strokes, and seizure disorders.
And there's no way to tell if you're going to get, like, if you have hypertension, then you have a higher chance. But people can get, even healthy people can just get strokes, correct?
That's correct. Yes, absolutely. Even people, the likelihood is less than people who obviously smoke and have cholesterol issues, who have diabetes and hypertension. The stroke risk starts to climb dramatically. But a person who is otherwise in great health, as occurred to one of my football coaches, who was having headaches for about 2 weeks, and then that evening succumbed at home because he had a Barry aneurysm that ruptured in his brain, and he was incredibly fit.
And he just died.
He just died from an intracranial hemorrhage that night. So again, that's pretty straightforward for the coroner to determine if he did have an intracerebral bleed that may have caused the unfortunate drowning.
So the fact that he's deferred the diagnosis, it probably wasn't those things, because he would have been able to tell that quite quickly, right?
Yeah, and again, they're probably determining toxicology as well.
That's what they said, yeah.
Yeah, to make sure there are no other contributing factors, and possibly, again, also ruling out foul play and so on, which
right. Well, apparently they've already ruled those out.
Right.
If you believe them.
Yeah. So
which we do.
Yeah. So those are the main ones, and it's an incredibly sad story, and it's one that I think has touched everyone worldwide, I would say, since Matthew Perry was obviously well known and very well liked.
Oh, my friends in Greece and England and France and Brazil are just as broken up.
Yes. And apparently, wasn't he exercising that day, that morning? Did he not go and do some sort of physical activity that was strenuous? And again, and someone who has a vulnerable plaque, can cause it to rupture, and then you have the cardiac arrest a little bit later, subsequent to the heart attack. So that could have contributed as well. And again, the autopsy could determine all of these things.
Right. We're just speculating at this point, but
Yeah.
I was just curious because we don't know the answer yet, and to
Yeah.
me, it seems very unusual that somebody that age could die. So I was just
Well,
curious to
yes.
find out.
Absolutely.
Since
And
you are the expert.
Yeah, the manner in which it happened.
Right.
So as you know, probably there are about 800,000 heart attacks per year in the U.S.
I did not know it was that
Yeah.
many.
Yeah, 600,000 are new heart attacks, and 200,000 recurrent ones, meaning in someone who's already had one.
And how
So-
many people die from the 800,000?
So it's in the neighborhood of about 30 to 40%.
Wow.
Because for many, it's the first sign. The incidence has gone down since the 1970s and 80s because of more awareness,
You mean the incidence of death?
of dying from a heart attack.
More heart attacks,
Yeah,
though.
there are fewer heart attacks now than before
Oh, there are?
per 100,000 population. Yeah, it's gone down significantly since 1990.
I would think
over
that
20 years.
I would think that with obesity higher and hypertension higher and diabetes higher, that there would be more heart attacks.
Well, that's a great point you make, but we have made some inroads on the medical side in terms of treating people and recognizing people earlier,
Got it.
putting them on medications. We have, antihypertensive medications, anti-anginal medications. We have cholesterol-lowering medications. We have better diabetic medications as time has gone on, and we have more awareness about smoking, even though in some places smoking is on the way up once again.
But smoking is way down from back then, so that makes a lot of sense.
Absolutely. And so even in minorities, the fact of the matter is, if you look at from 1990 to about 2010 or so, there was a dramatic decrease in the incidence of heart attacks in minority populations. I mean, in everybody, whites, blacks,
Right.
Hispanics, and Asians. And then there's been a plateau since Obamacare started. We have kind of stayed at about the same level over the last 12 years. So in most populations. And again, I'm quoting data from the Kaiser Family Foundation database, which has a very extensive and very rich source of information on this.
Well,
So-
those insurance companies they keep very good statistics. That's
Absolutely.
for sure.
So our goal is obviously to keep the population as healthy as possible, and to spread the message about early detection of risk factors. And we never know. Matthew Perry could have had one or more of those risk factors I just mentioned that could have caused a cardiac arrest.
Well, thank
You
you
know?
for that, Fred. That's very informative. Anything else you want to add about this topic?
Just that if you have any symptoms or concerns or a strong family history in your direct family members, like your parents, your grandparents, that may have had a premature heart attack, meaning before the age of 60, then you should get checked out.
Okay, that's a great message. And please like and subscribe the podcast. Follow us on Instagram, Facebook, TikTok, and YouTube. Yeah, thanks for joining us, everybody.
Thank you.